Motherhood generally brings joy not just to the woman, but also the family and the community. It is a special responsibility handed to women by God for human reproduction and nurturing of not just the children, but generations. As the society looks up to celebrating these newborn children, many of the women carrying the babies end up suffering from health challenges, which on many occasions lead to the loss of lives of the mothers. The World Health Organization estimates that over 800 women die every year from preventable causes relating to pregnancy and childbirth, with 94% of all maternal deaths occurring in low-income countries. In Nigeria, for example, the lifetime risk of a woman dying during pregnancy, childbirth, and post-abortion is 1 in 22, in contrast to the lifetime in developed countries. Now, over the years, governments, international organizations, and concerned individuals have continued to work towards reducing the maternal mortality ratio. One of these steps taken included the declaration of the National Safe Motherhood Day in 2003. It is a day observed to sensitize the public on the need to ensure women have access to quality and adequate health care during pregnancy, childbirth, and postnatal services. With COVID-19 taking its toll on the global community, Nigeria Today will be looking at how to prevent the negative effects of the dreaded disease on pregnant women and newborn babies. Now, what other factors are responsible for maternal and child deaths, and what are the mitigations? Welcome to the program. I'm Dennis Adigunloye. All right, with me in the studio to discuss Safe Motherhood is the Director, Primary Health Care, FCT Primary Healthcare Board of the Health and Human Services Secretariat at the FCTA, Dr. Rukaya Wamako. You're welcome to Nigeria Today.
Thank you. Welcome, viewers.
All right, and also joining us via Zoom is the Program Manager, National Emergency Maternal and Child Health Intervention Center, Dr. Leila Umar. You're also welcome to the program, Ma.
Thank you. Thank you for having me.
Come to you very shortly. Let's start with our guest in the studio, Dr. Rukaya. Let's look at Safe Motherhood. How vital is this to the society?
Safe motherhood is vital to the society because in every family there is a woman, and in every family need a woman to survive, and then we need to do whatever we can do possible to make women survive, because if a woman survive, we have a good society and the whole society is surviving. And a woman needs to survive by going through pregnancy, lactation, and care of a child, because when a woman is carrying pregnancy, she's at risk. Although pregnancy is a thing of event, it's supposed to be a normal physiological phenomenon, but along the line, anything can happen for that woman, for her to undergo this normal physiological phenomena. It's a great task for a woman to carry pregnancy, carrying a life carrying a life into it, and then life coming out of life. That is what a woman is undergoing. And we need to do a lot in the society, the community, to see to it that, and the government as a whole, to see that this event has gone peacefully, and then our women survive, and then we have a great nation, we have a great society, and the world at large.
All right, one death in 22 pregnancy-related cases in Nigeria. What are your thoughts on this statistic, Dr. Rukaya?
Pregnancy and lactation. Come again with your question.
Yeah, one death in 22 pregnancy-related cases in the country, Nigeria. What's your take on the statistic?
Okay, The statistic quite okay. You know, in Nigeria or in developing countries as a whole, statistic, data collection, and research is a difficult thing to do. But even at that, we all know that in developing countries, the woman, whenever she is pregnant, her life is at risk. So the statistic may be saying the truth. And then our maternal mortality, we know that is high in Nigeria. We're having, according to the NDHS 2018, we're having 512 per 1,000 live births. And with this statistic, we all know that though we have some reduction, but also we are at the high side, looking at the population of Nigeria.
All right, let me bring in our guest joining us via Zoom, Dr. Leila Umar. Dr. Leila, just give us your thoughts on that statistic, one death in every 22 pregnancy-related cases in the country.
Yes, so the statistics is really the grim reality that Nigeria, we're not doing well in terms of, saving the lives of women, especially during pregnancy and delivery. Every day in Nigeria, we lose 145 women from pregnancy and delivery-related conditions, and in most instances, these are preventable causes. So, and we have seen how globally set targets for reducing maternal mortality, such as the Millennium Development Goals, set out goals for countries, which countries, including Nigeria, signed up to. However, Nigeria could not make it in terms of making any progress to reduce maternal mortality. Now we have global targets, the Sustainable Development Goals, which have set the target for us to reduce maternal mortality to 70 per 100,000 live births. Now, this is really a tough one for Nigeria, looking at the present, statistic of 512. How do we get to reducing maternal mortality to 70 by 2030? We need to do business unusual. We need to be disruptive in how we approach addressing these causes of maternal mortality. And one way of doing it is raising awareness through the Safe Motherhood Day, which is going to be celebrated in Nigeria on May 22nd. It's an avenue for creating awareness on the need to seek for care. Every woman, including women that are in the rural areas, to seek for care when they are pregnant and when they deliver. So we believe that with such interventions, such disruptive approaches, we would be able to improve the maternal mortality statistics in Nigeria.
Right, staying with you, Dr. Leila, what would you say are the contributing factors in this high rate of maternal and child mortality in Nigeria?
So the best way to explain these factors is when we look at the 4 delay model. The 4 delay model starts with the first delay, and that is the delay in decision to seek for the right care. When a woman is pregnant, she needs to make the right decision as to where she would receive her antenatal care from and where she would deliver. In most instances, poor health-seeking behavior results in the woman making the wrong decision, as well as harmful, socio-cultural practices. So the woman resorts to alternative means of care, such as the TBEs, which in most cases are harmful and may lead to those of the loss of the life of the woman. We have seen that most of these mortalities occur in the community, either within the home, the household of the woman, or on her way to the health facility, or within the home of a TBE. Only 15% of these deaths occur in the health facility. And most instances, it's that delay in decision making. Then we also have the second delay, which is the delay in reaching care. So the woman decides that she's pregnant, she needs to go for antenatal care, or she's in labor, she needs to go to a health facility to deliver. However, because of difficult terrains, because of poor road networks, because of lack of access to transport, there's that delay. And in most, we have situations where the woman dies on her way to the health facility. The third is the third delay to care. So she reaches the health facility, she's in labor, she has bypassed the first and second delay. But upon reaching the health facility, she's not accepted, or she doesn't receive the right care she needs to help her go through the safe period, or the safe through safe delivery. And unless we see how we address this third delay, we stand a chance of losing this woman. And it could be as a result of her going to a primary health facility and it is closed with no health worker. It could be as a result of she needs some life-saving commodities in the health facility and it is not available. The fourth delay is that she needs advanced care. Maybe she has obstructed labor and she needs emergency cesarean section. So she's referred to the secondary or tertiary health facility. However, there is delay in her getting to that referral center or delay in her being accepted in the referral center. So that can also be a cause of us losing the life of that woman. So across these 4 delays, we also have, the major drivers of the mortality. In most instances, this woman died from hemorrhage or from eclampsia or preeclampsia, as we call it. So these are really the major causes of maternal mortality.
Right. Thank you for that, Dr. Leila. Let me bring back our guest in the studio, Dr. Rukaya. These 4 delays, where would you say they are most prevalent? Which areas of the country? We talk about the rural parts of Nigeria, but which ones are more pronounced with regards to these 4 delays? And what are the actions being taken to mitigate these issues?
Actually, if I'm to say, I would like to say that in each part of delay there is a problem, and in each part of delay is also important there. But I would like to emphasize more on the delay, on the first delay. First delay, the delay at home, for a woman to
making the decision.
Yes, for a woman to decide. Most at times, when you look at our women in the society, you look at our women at home, that a woman is not part of decision. She cannot make decision for herself. Sometimes the husband or the mother-in-law or the father-in-law decide for her because of the social, cultural, religious activities surrounding her, depending on the community where she comes from. People in the community will surround her with all sort of religious and socio-cultural factors that would tie her down for her not to make decision. And then another thing is that sometimes in some cultures you look at, a woman is a pride for her to deliver alone.
Alone?
Yes, to deliver alone, unassisted. It's a pride
is that not a bit primitive?
It is quite okay, but it's a pride to some of our cultures. A woman will labor alone, deliver alone before she knocks at the neighbor's door and said, come and see, I have delivered. Even some of them will cut the cord by themselves, deliver the placenta by themselves, because natural oxytocin will definitely come in. But it's not every delivery that will come like that. Most at times, delivery will come with some complications, particularly when it is first delivery and then when she is grand multiparous. Definitely a problem will come. And you will not see in this pregnancy which one is going to have a problem. So decision making at home is a problem. And then that delay, access to transport is also another major problem. You see, sometimes you see that even neighbors are not willing to assist. A labor will start in a neighboring house. Where the labor started, they don't have means of transportation. They would now like to say, maybe let me knock at the door of my neighbor, he has a car, to help me and transport my wife to the facility, because the labor is a thing of event. It happens in the night. It's a kind of cycle. Most at times, majority of deliveries come at night.
Yeah.
Yes. So because of that, he will knock at the door. It's either no answering, or maybe I don't have fuel in my car, or my car is bad. Something like that. Then the woman will now have a delay along that side, getting transport to get to the facility. So you see, even that one is also a problem, and I can say that one is also part of the society. It's part of the society. Then when she was able to be transported to the facility, then our healthcare attitude, how to receive her, how to accept her, the protocols there, getting card, do this, particularly if she is unbooked. It's more pronounced if she is unbooked. That woman is more pronounced there because she has never come for antenatal. She is coming for the first time. She wants to deliver in the stages, because labor have stages. Maybe it depends on the stage she arrived in the facility. That delay can happen, and then anything can happen for that woman at that stage. Then when it comes to after they attended to her, now as they attend to her, they now found that there is maybe a complication that she may not be able to deliver by herself. She need another, depending on the facility she arrived. Supposing a remote primary health care, or at the primary health care, we have stages of primary health care. We have the health post, we have the primary health care clinic, and we have the primary health care center. So it depends on which one she get herself into. Is it a health post or a clinic? And each and every one of these stages of primary health care, they have the services they render. And then the most senior among them is the primary health care center, where she can be able to at least have a cesarean section if she has to have assisted delivery there. Or else they have to transfer her again to secondary facility where she can access assisted delivery either by cesarean section or by whatever means of delivery. So in each and every part of deliveries, these delays, they are important, but more pronounced at decision making. The delay at decision making is the most dangerous.
That is most critical. All right, we'll continue the discussion shortly. The program is Nigeria Today. Let's pause and hear from some members of the public on what they think about preventing maternal and child deaths in Nigeria. Stay with us.
They should go for early antenatal, then they should involve in all this child spacing and also family planning. If you know that your strength can no longer carry pregnancy, you should stop.
Advice I give them is to comply to the order, because the people that are telling them to come for antenatal, they have the ideology, what it takes to take care of the little children in the womb. Many a times they say that devil cause them, but they stay at home.
The professional says it's no good when you are pregnant to take alcohol. So any woman that is taking, they should stop taking it for the baby and the mother.
If the woman reduce the rate at which she overstress herself in the house chores and maybe at office also, the husband can probably help in the house chores also, and maybe, depending on how it is, they can get someone to help out.
Government can do a lot. First, they can use even NTA to educate women. When there is enough education about certain occurrences, people can remedy for themselves. Then secondly, government can go ahead in what they have started doing, building more health facilities around the country.
All right, you're welcome back. The program is Nigeria Today. We are discussing Safe Motherhood with the Director, Primary Health Care, FCT, Primary Health Care Board of the Health and Human Services Secretariat at the FCTA, Dr. Rukaya Wamako. And via Zoom is the Program Manager, National Emergency Maternal and Child Health Intervention Center, Dr. Leila Umar. Dr. Leila, let's talk a bit about the coronavirus, which has been significant globally over the past year plus now. How can we prevent mothers and newborn babies, contracting this deadly disease?
So the coronavirus pandemic, no doubt, has really caused disruption in our primary healthcare system as well as in the service delivery. And it has also disrupted uptake of services. And in most instances, at the start of the pandemic, it was as a result of fear from contracting the disease from the side of the patient, that is the mother in this case, and from the side of the health workers. But After that, responses that were mounted in terms of protecting, reducing transmission have improved the uptake of services especially by women for antenatal care and delivery. It's very important to protect the mother when she's pregnant because she is vulnerable and she's in a condition where her immunity is not that optimal. So she stands at risk of contracting COVID-19 as well as complications from the virus. When a woman goes to the health facility, she's exposed, and there's a likely chance that if care is not taken, she can contract the disease in the health facility. So we have developed a strategy which is called the Optimizing Antenatal Care and Delivery Amidst COVID-19. And it looks at factors that reduce the contact time between the mother and the caregiver in the health facility, the health worker in the health facility. It also looks at reducing the waiting time, the period the woman has to stay in the health facility when she goes for antenatal care. So how do we do this? First is, rather than the norm of a woman going for antenatal care and together with other women, congestion and difficulty in terms of maintaining that social distancing, we look at how we would reduce the load, the client load, the patient load during antenatal care. And the best way to do this is when we have a staggered way of women attending the health facility. So we increase the number of antenatal care sessions, and we schedule appointments using community mobilizers for primary health centers through this community, the schedule for antenatal care. So she's able to choose whether to go in the morning, afternoon, and what day of the week, so that when she goes, she's promptly attended to. She doesn't have to wait for long, thereby reducing her exposure time. The other method is reducing the time she's exposed to the health worker and vice versa. So that is reducing the procedures. You know, sometimes when they go to the health facility, there's expected to be health talks. So rather than grouping the women and giving them health talks by the health worker, we have innovative ways. So bringing flyers and pamphlets that are pictorial for women that are not literate, having radio programs that serve as health promotion avenues for the woman rather than the woman sitting during the waiting period, you know, for the health talks. Then very importantly, enforcing and during the health education sessions in the radio or through the pamphlets, letting the women know how to protect themselves, using face masks, using hand sanitizers, ensuring distancing, even outside the health facility. It is very important that she protects herself and her baby. And you know, that traditional practice of when a woman delivers, she's exposed, she receives guests, she's still within that vulnerable period. So it's about making the woman understand that she needs to reduce her exposure and that of her baby to COVID-19.
Sure, that is very critical. All right, let me give the last few seconds of the program to our guest in the studio. Just talk to us very briefly about nutrition, not only for the mother, but breastfeeding as well, how important to good health and beating these maternal mortality.
Yes, when you are talking about maternal nutrition, it's a well-versed topic, and then we will start looking at the maternal nutrition from the adolescent girl. Because what we eat and how your lifestyle is during the adolescenthood, that is what will make you to develop to become a matured woman, and then have your pelvis grown, and then hormones adjusted to be able to carry pregnancy. So the eating habit, what you eat, and then the supplementation you take during that time, because you menstruate monthly, so a adolescent girl needs supplementation because every month they lost blood, so they need supplementation. They need to eat healthy, they need to eat a protein, carbohydrate, and oil, fat, water, fruit and vegetables where they can get the vitamins, and then supplementation because they monthly menstruate. And then what they eat there, that will balance their hormone, and then make them to grow, pelvis to grow, and be able to carry pregnancy. And when they carry pregnancy, also the eating habit, also that plays, it has to be an eating habit that is healthy. They should avoid alcohol because of the pregnancy. They should avoid hard drugs. They should avoid all harmful substances, and then be able to eat healthy, normal protein, carbohydrate, minerals, fruits and vegetables, and a lot of water.
And for the baby, how many months for breastfeeding? The minimum requirements. Yep.
Okay, for breastfeeding,
Briefly,
usually
10 seconds.
it's exclusive breastfeeding. After she delivers.
For how many months? 6 months?
For 6 months.
Yep.
Exclusive breastfeeding
Sure.
for 6 months. When we say exclusive breastfeeding here, nothing but water, zero water. Zero water, just breast milk for 6 months.
All right.
Then after 6 months, then complementary feeding will now come. Then she now continue breastfeeding with complementary feeding
All right.
for 2 years.
Our time is up, but we definitely got the points loud and clear. Thank you to you, Dr. Rukaya Wamako, Director, Primary Healthcare, FCT Primary Healthcare Board of the Human Health and Human Services Secretariat, FCTA. Many thanks for sharing your thoughts and perspectives with us. Thank you. And thanks also to Dr. Leila Umar, Program Manager, National Emergency Maternal and Child Health Intervention Center. Thank you, Dr. Leila, for your thoughts as well.
Thank you.
All right, and thanks to you out there, the viewers, for watching. And do remember, Nigeria Today is live at 7:30 in the evening every weekday. You can also watch this and other editions on youtube.com/NTA News 24 Hub. I'm Dennis Adigunle. Thanks for your time.